Remember, we did say at the start of the show that October is usually dedicated to create awareness on the breast cancer, and we have Calabar will be going pink in some days from now, and I have a team to come talk to us on breast cancer. We actually started a talk briefly with the DG yesterday, and today we'll have an in-depth talk on the breast cancer. We have in the house Egbe John. He is the project manager, health outreaches and medical interventions at Pink Africa Foundation. Good morning, sir.
Good morning.
And we have the lady with us, Comrade Nurse Prudence Agi, representing UCTH. Good morning, nurse.
Good morning. Good morning, viewers.
Okay, let me start with Egbe John. Breast cancer, quite a lot of people are suffering from this, not knowing anything about it. So I would love you to put it there on the floor. What really is breast cancer? So sadly, I'm starting with a man to ask this question.
It's fine. It's fine. Well, good morning once again.
Good morning.
Like you already posited, breast cancer is the one cancer that you will not catch on time if you don't make a conscious effort at catching it. All right. So what is this breast cancer? Let's start by knowing what a cancer is. As we all know, growth is the condition of all things. But this growth must be within the limits of normalcy. Where any organ or system or cell in the body loses control of normal growth, the growth becomes abnormal. So that's what essentially is cancer, an abnormal growth or abnormal proliferation. I don't want to use technical terms, let's just stay simple. That when a particular group of cells or a particular organ loses control of the normal growth, like we all know in life, everything is revolving around check and balances. So when the system loses ability to check and balance growth of any cell or organ, it's we call it cancer. So when such a situation arises in the breast, where there is abnormal growth of a group of cells in the breast, it is called breast cancer. Permit me to just further say that the breast is made up of different parts. We have the milk secreting part, we call it globules. We have the fat cells, we have blood vessels, we have lymph nodes. And this cancer can arise from any of these structures around the breast. Thank you.
All right, let me move now to Comrade Prudence. Most times when we say breast cancer, it's always a focus on the women. But of late we notice that even the men also have breast cancer.
Yes.
Can you talk to us on that?
It's true. You know, being female alone, puts you at risk of breast cancer. You see the proportion for males is very minimal. Maybe 1 in 100 or more. Very minimal, negligible, insignificant data on it. So just few of them, they are not really at risk, but they do develop breast cancer too. They do.
Okay, so what are some of the risk factors that could contribute to one having a breast cancer, both male and female?
Okay, for the females, the fact that I'm a female places me at risk of breast cancer. And increasing age, because as you age, you are at risk. And then we talk of lifestyles, obesity. Where you don't have a good weight control, you could have breast cancer. Inactive life, you live a sedentary lifestyle, you're not active. Then hormonal therapies, we do contraceptives. It also places you at risk for breast cancer.
So how about the men?
Because, like we say, breast is not known, but the same thing, you are not checking yourself. You may not know when you have it. It's almost the same thing, placing them at risk.
Okay, Egbe John, let me quickly find out. Maybe you have something to add, right?
Yes, I just want to make further impute on what she's deposited. Basically, being a female places you more at risk. But where breast cancer occurs in a male, it is almost always an invasive type. That means it is more severe if breast cancer occurs in a male. Although, like you said, the number is negligible, but it is something that is worrisome to note. And where you come from, the race, also places some people at risk. And let me quickly say that there are two types of risk factors. Some are modifiable, some are non-modifiable. Like the ones that are modifiable are the ones within your reach. Someone can decide to quit smoking because smoking puts some people at risk of breast cancer. Someone may decide to quit alcohol, because alcohol is a type of risk, constitute a type of risk to development of breast cancer. And then someone may decide to quit sedentary lifestyle, to get active, get involved in various exercises. And also those ones are modifiable risk factors. But people don't have a way of modifying their age. You cannot modify your age. So naturally, you don't even choose where you come from. And also those are the non-modifiable, like age. You cannot change the fact that you're a woman. And you cannot change the fact that you are black or white. Okay, because from literature, whites are more prone to developing breast cancer. So if you are black, your risk is reduced compared to being white. So I just wanted to chip in that.
There's also the gene thing. Some genes we inherit from our stock. Like for the females, there's a gene, the BRCA. If you have it, you could develop breast cancer.
Okay,
so hereditary has a role too to play.
Okay, because I wanted to find out, I wanted to ask in that. But let me quickly find from you, aside going to the hospital first, what should be those regular exercises as a woman that you should do at home to be checking your breast in case there is any lump there?
And that is where the breast self-examination comes in. We advise women to check their breasts. You could do it when you're in the bathroom. You could do it standing before a mirror in the house. You check your breast regularly, and I think we advise you to do it about 7 days after your menses, because before that, you could not get anything really tangible. That helps you to detect early. Though some, breast situations occur, you will not detect early, but there's mammogram is the fastest way. We advise people when you're up to 40, try and go for mammography. That will be early. Any changes.
Okay, so breast self-examination and a mammogram test. Now let's look at prevention. What can one do, male or female, to reduce the risk of having breast cancer, basically preventing it?
Like we said, early detection is key to everything. So we advise people, start from your self-breast examination, look at your breast. Are there changes? Is the nipple retracted, as in it's dimple in? It gives you a guide, it's not normal. Are there thickness? Are you seeing a kind of orange-like skin? Is a sign that something is wrong. Is there redness around the breast? It's not normal. Are there discharges? When you see those things, you have to run to the hospital and seek further medical advice.
Okay, Ebe, you want to add something here?
Yes, please. Thank you very much for that question. Prevention is key. And, essentially, the main drive, we used to say prevention is better than cure. Like you said, you have to be breast self-aware for you to know when there's a deviation from normal. So first and foremost, we advocate breast self-examination every month, 10 days, 7 to 10 days after menses, because if you do it earlier than then, the breast in the course of menses become lumpy, so you may not be able to decipher which is which about them. Then every 3 months, it is advisable for women to go for clinical breast examination. That means you go to a hospital and a doctor does breast examination, because what you cannot pick as an individual, a medical professional may be able to pick it. And then as soon as one clocks the age of 35 to 40, it's advisable for one to doing annual mammography. Mammography is a special X-ray that's able to pick the consistency of the breast. If there's any deviation from normal, it will raise alarm, red flag. Then the other thing to do is, if there is a personal history of breast cancer, because some people have breast cancer in one breast, such a person stands at risk of developing cancer in the other breast. So you do, or if there's a family history, if there's anybody in the family who has breast cancer, such a fellow should do mammography every year, irrespective of the signs. You don't need to have signs, because most times when there is any change in the architecture of the breast, it's an advanced disease. So the watchword here is prevention. Again, there are a whole lot of gamuts of risk factors, like I mentioned earlier. If obesity, overweight are all risk factors, so weight reduction will go a long way to help reduce the incidence. If one was smoking before, smoking places people at risk of breast cancer, so quit smoking, quit in-exercise, get to exercise daily, and then oral contraceptive pills. Some people take oral contraceptive pills. It places people at risk too, so reduce intake of that. Then breastfeeding, let me just quickly hammer on that. It is thought that if a woman sees her menses in life early, the menses is supposed to resume from 12, but some people see it earlier than that, and then the menses is supposed to stop from 50 years. Some people see it later than 50, 55. Those people are exposed to the chemical that predisposes to breast cancer more. We call it estrogen. So those set of people are at higher risk. So if anyone belongs to that category, the four projected efforts should be made: breast examination, clinical breast examination, and then mammography. Some people even do prophylactic mastectomy. That means because of the consciousness that, look, breast cancer, my mother has breast cancer, they could take out their breasts just to prevent the occurrence of breast cancer. Thank you.
All right, thank you very much. I think we'll just have to leave it at that. Egbe John, Project Manager, Health Outreaches and Medical Interventions, Pink Africa Foundation. Thank you, sir, for coming on the show. And Comrade Nurse Prudence Agi, representing UCT. Thank you very much, gentleman and lady, for coming on the show. We hope to have you next week when you'll be hitting the streets of Calabar.
Painting the town.
Yeah, painting the town pink.